Question 1. A Certified Dietary Manager, CDM, is responsible for ensuring that food served in a healthcare facility meets specific safety standards. What is the maximum number of hours that potentially hazardous food can remain in the temperature danger zone, TDZ, before it must be discarded? A. 1 hour. B. 2 hours. C. 4 hours. D. 6 hours. Answer: C. 4 hours. This question tests your knowledge of food safety regulations, specifically the time temperature control for potentially hazardous foods, PHF. The keyword maximum number of hours refers to the total cumulative time PHF can spend between 41 degrees Fahrenheit and 135 degrees Fahrenheit, which is the temperature danger zone, before it becomes unsafe to consume. According to food safety guidelines, any food left in this zone for 4 hours or more must be discarded to prevent the rapid growth of harmful bacteria. For example, if a pan of cooked chicken is left out on a counter for more than 4 hours, it must be thrown away. Always remember that 4 hours is the absolute limit for the temperature danger zone. Question 2. A resident with dysphagia is at high risk for aspiration. Which food texture modification would be most appropriate for this resident? A. Regular consistency foods. B. Mechanically altered foods. C. Pureed foods. D. Liquid foods. Answer: C. Pureed foods. This question assesses your understanding of therapeutic diets and modifications for dysphagia, a condition causing difficulty swallowing. The keyword aspiration is a critical clue, indicating that food or liquid could enter the airway and lungs, which is a serious risk. Pureed foods are specifically designed to be smooth and uniform in texture, requiring minimal chewing and swallowing effort, thereby significantly reducing the risk of aspiration. For example, a resident with severe dysphagia might receive pureed chicken, mashed potatoes, and thickened beverages to ensure safe swallowing. When a resident has difficulty swallowing, remember that smoother, uniform textures like pureed foods are generally the safest option. Question 3. When preparing a budget for the food service department, which of the following is considered a variable cost? A. Rent for the kitchen facility. B. Manager's salary. C. Food supplies. D. Equipment depreciation. Answer: C. Food supplies. This question tests your understanding of budgeting principles, specifically differentiating between fixed and variable costs in a food service operation. The keyword variable cost refers to expenses that change in proportion to the volume of meals produced or services rendered. Food supplies directly correlate with the number of meals served. More meals mean more food purchased. In contrast, rent, salaries, and depreciation are typically fixed costs that do not fluctuate with meal volume. For instance, if meal census increases, the cost of ingredients like meat or vegetables will rise, making food supplies a clear example of a variable cost. Think of variable costs as items that vary directly with activity levels. Question 4. What is the primary purpose of a hazard analysis and critical control points (HACCP) system in a food service operation? A. To identify staff training needs. B. To ensure financial stability. C. To prevent foodborne illness. D. To improve customer satisfaction. Answer: C. To prevent foodborne illness. This question focuses on the core function of the HACCP system, a globally recognized approach to food safety. The keyword primary purpose directs you to the most essential objective of HACCP, which is a systematic process designed to identify, evaluate, and control food safety hazards. Its main goal is to proactively prevent foodborne illnesses by addressing potential biological, chemical, or physical hazards at critical points in the food production process. For example, HACCP procedures would dictate specific temperatures for cooking poultry to eliminate pathogens. Remembering that HACCP stands for Hazard Analysis and Critical Control Points helps you connect it directly to preventing food hazards and ensuring safety. Question 5. A CDM needs to delegate the task of inventorying dry storage to a new employee. What is the most important step the CDM should take to ensure the task is completed accurately? A. Simply tell the employee to do it. B. Provide clear instructions and training. C. Threaten disciplinary action if not done correctly. D. Do the task themselves to ensure accuracy. Answer: B. Provide clear instructions and training. This question assesses your knowledge of effective delegation and staff training within a management role. The keyword "most important step" highlights that successful delegation requires more than just assigning a task. It demands proper preparation and support for the employee. Providing clear, specific instructions and hands-on training ensures the new employee understands the correct procedures and standards for completing the inventory accurately. For example, the CDM should show the employee how to count items, use the inventory sheet, and where to store specific products. Always remember that effective delegation is about empowering employees through clear communication and proper training, not just offloading tasks. Question 6. A resident with chronic kidney disease, CKD, who is on dialysis requires a diet that carefully controls which nutrients? A. High carbohydrates, low protein, low sodium. B. High fat, high fiber, restricted fluids. C. Restricted protein, restricted sodium, restricted potassium, restricted phosphorus, and controlled fluids. D. Unrestricted protein, unrestricted fluids, low carbohydrates. Answer: C. Restricted protein, restricted sodium, restricted potassium, restricted phosphorus, and controlled fluids. This question tests your understanding of dietary modifications for patients with chronic kidney disease, CKD, on dialysis. The keyword "on dialysis" indicates a severe stage of kidney failure, which significantly impacts the body's ability to excrete waste products and regulate fluids and electrolytes. Therefore, a diet for these patients must carefully restrict protein to reduce kidney workload, along with sodium, potassium, and phosphorus due to impaired excretion, and fluids to prevent fluid overload. For instance, a patient on dialysis might need to limit bananas, high potassium, dairy products, high phosphorus, and processed foods, high sodium. Always remember that kidney disease diets focus on limiting nutrients that the kidneys struggle to filter out. Question 7. What is the primary benefit of maintaining a perpetual inventory system in a food service operation? A. Reduces the need for physical inventory counts. B. Provides real-time information on stock levels. C. Eliminates all instances of food waste. D. Lowers the overall cost of labor. Answer: B. Provides real-time information on stock levels. This question focuses on inventory management systems, specifically the advantages of a perpetual inventory. The keyword "primary benefit" points to its most significant advantage, which is its ability to continuously track inventory balances. A perpetual inventory system updates stock records immediately after items are received or issued, providing an up-to-the-minute overview of what is on hand without needing to physically count every item constantly. For example, a CDM can instantly check if they have enough chicken for tomorrow's menu by looking at the system. This real-time insight helps with accurate ordering and reduces the chances of running out of essential ingredients. Question 8. What is the most effective way for a food service worker to prevent the spread of norovirus in a facility? A. Wearing gloves at all times. B. Frequent and proper hand washing. C. Using hand sanitizer frequently. D. Limiting contact with residents. Answer: B. frequent and proper hand washing. This question assesses knowledge of hygiene practices crucial for preventing the spread of highly contagious viruses like norovirus in a food service setting. The keyword most effective way emphasizes the gold standard for preventing such infections. Frequent and thorough hand washing with soap and water is superior to hand sanitizer or gloves alone, as it physically removes virus particles that might not be killed by alcohol-based sanitizers or contained by gloves that can become contaminated. For instance, after handling raw meat or using the restroom, washing hands correctly is vital. Always remember that diligent hand washing is your best defense against many foodborne illnesses, especially norovirus. Question 9. When a resident is receiving enteral nutrition, tube feeding, what is a key indicator that the feeding rate might be too fast? A. Increased urine output. B. Elevated blood pressure. C. Abdominal distension or diarrhea. D. Improved appetite. Answer: C. Abdominal distension or diarrhea. This question delves into the practical aspects of providing enteral nutrition, or tube feedings, to residents. The keyword key indicator prompts you to identify a common sign of intolerance when the feeding formula is administered too quickly. Abdominal distension, bloating, and diarrhea are classic symptoms that the gastrointestinal tract is struggling to process the volume or rate of the feeding, often suggesting the need to slow down the infusion. For example, if a resident receiving a continuous tube feeding suddenly experiences cramping and loose stools, the CDM should investigate the feeding rate. Recognizing these gastrointestinal symptoms helps ensure patient comfort and proper nutrient absorption. Question 10. A CDM observes several staff members frequently using personal cell phones during work hours, impacting productivity. What is the most appropriate initial action for the CDM to take? A. Immediately implement a zero-tolerance policy. B. Discuss the issue with individual staff members and remind them of the policy. C. Report all staff to Human Resources for disciplinary action. D. Ignore the behavior as it is a minor issue. Answer: B. Discuss the issue with individual staff members and remind them of the policy. This question assesses effective management and communication strategies for addressing staff performance issues. The keyword most appropriate initial action indicates that the first step should be corrective and educational rather than immediately punitive. Discussing the issue directly with the staff members involved allows the CDM to remind them of the existing policy regarding cell phone use and its impact on work, often resolving the problem informally. For instance, the CDM might pull an employee aside and say, "I've noticed your phone use is affecting your tasks. Please remember our policy." This approach promotes a positive work environment and gives employees a chance to correct their behavior before formal action is considered. Question 11. To prevent cross-contamination in the kitchen, what is the best practice for storing raw meat? A. On the top shelf of the refrigerator. B. Below ready-to-eat foods. C. Next to fresh produce. D. In an uncovered container. Answer: B. Below ready-to-eat foods. This question focuses on a critical food safety principle, preventing cross-contamination. The keyword best practice directs you to the most effective method for minimizing the transfer of harmful bacteria from raw meat. Storing raw meat on the lowest shelves, below ready-to-eat foods, prevents any potential drips or leaks from contaminating cooked foods, fruits, or vegetables that will not be cooked further. For example, raw chicken breasts should be stored on the bottom shelf, underneath a pan of prepared salads. Always remember the bottom-up rule for storage. Raw items, especially meats, should always be on the lowest shelves to avoid drips onto other foods. Question 12. When evaluating a new food product for potential inclusion on the menu, a CDM should first consider its A. Brand popularity. B. Price and quality. C. Availability from multiple vendors. D. packaging attractiveness. Answer B. Price and quality. This question evaluates the practical considerations involved in menu planning and purchasing for a food service department. The phrase "first consider" guides you to the most fundamental factors for any new food product. While other options have some relevance, the initial assessment must always weigh the product's price against its quality to ensure both cost-effectiveness and customer satisfaction. For example, a CDM wouldn't just pick the cheapest ground beef. They would compare its cost to its lean-to-fat ratio and overall appearance. Balancing these two key aspects ensures good value and meets the facility's standards. Question 13. A resident's diet order states NPO except for meds. What does NPO mean in this context? A. New patient only. B. Nothing per OS. C. Nutritional protein order. D. Needs preoperative oversight. Answer B. Nothing per OS. This question tests your knowledge of common medical abbreviations used in healthcare settings, which are crucial for accurate diet order interpretation. The term NPO is a widely used Latin abbreviation that stands for nil per OS, meaning nothing by mouth. When a resident has an NPO order, it indicates that they are not allowed to consume any food or drink, except for specific medications, as per the physician's directive. For example, a resident undergoing a surgical procedure might be NPO after midnight. Understanding this abbreviation is critical to prevent serious adverse events and ensure patient safety. Question 14. What is the primary purpose of a standardized recipe in a food service operation? A. To allow cooks creative freedom. B. To ensure consistent quality and portion control. C. To reduce the number of ingredients needed. D. To speed up the cooking process. Answer B. To ensure consistent quality and portion control. This question explores the benefits of using standardized recipes in a professional kitchen. The keyword primary purpose points to the most significant advantage of these recipes. Standardized recipes provide precise instructions, including ingredient amounts, cooking methods, and portion sizes, which ensures that every time a dish is prepared, it tastes the same and is consistently portioned. For instance, if a standardized recipe for chicken soup is followed, it will consistently have the same flavor, texture, and yield every time it's made, regardless of who is cooking it. This consistency is vital for customer satisfaction and managing food costs effectively. Question 15. A resident complains frequently about the same menu item. What is the best initial approach for the CDM to address this recurring complaint? A. Remove the item from the menu immediately. B. Ask the resident for specific feedback and suggestions. C. Tell the resident to try other menu items. D. Ignore the complaint as it's only one resident. Answer B. Ask the resident for specific feedback and suggestions. This question focuses on effective customer service and communication strategies for a CDM. The keyword best initial approach indicates that the first step should be to gather more information directly from the source. Asking the resident for specific feedback allows the CDM to understand the exact nature of the complaint and potentially gather constructive suggestions for improvement. For example, instead of just saying, "I don't like the chicken," the resident might specify, "The chicken is too dry," which provides actionable feedback. Actively listening to residents and seeking their input demonstrates responsiveness and a commitment to quality improvement. Question 16. What temperature range is considered the temperature danger zone for food? A. 0 degrees Fahrenheit to 32 degrees Fahrenheit. B. 32 degrees Fahrenheit to 100 degrees Fahrenheit. C. 41 degrees Fahrenheit to 135 degrees Fahrenheit. D. 135 degrees Fahrenheit to 165 degrees Fahrenheit. Answer, C, 41 degrees Fahrenheit to 135 degrees Fahrenheit. This question directly tests a fundamental concept in food safety, the temperature danger zone, TDZ. This specific range is critical because it's where pathogenic bacteria multiply most rapidly on potentially hazardous foods. Food must pass through this zone quickly during heating or cooling, and it should not remain in this range for more than 4 hours cumulatively. For example, hot food held for service should stay above 135 degrees Fahrenheit, and cold food below 41 degrees Fahrenheit, to avoid the danger zone. Understanding and adhering to these temperatures is paramount for preventing foodborne illness. Question 17. When reviewing a resident's medical chart, the CDM notes a recent significant unintentional weight loss. What should be the CDM's immediate next action? A. Recommend a calorie-restricted diet. B. Notify the physician or nursing staff and suggest a nutritional assessment. C. Disregard the weight loss if the resident seems healthy. D. Increase physical activity for the resident. Answer, B. Notify the physician or nursing staff and suggest a nutritional assessment. This question highlights the CDM's crucial role in resident care and interdisciplinary communication. The keyword immediate next action emphasizes the urgency of addressing unintentional weight loss, as it can indicate underlying health issues or malnutrition. Notifying the physician or nursing staff is essential because they are part of the interdisciplinary team and can order further medical evaluation or a comprehensive nutritional assessment by a registered dietitian nutritionist, RDN. For instance, significant weight loss could be a symptom of a new illness or a change in appetite requiring immediate attention. Recognizing and communicating changes in a resident's nutritional status is a core responsibility of a CDM. Question 18. What is the primary purpose of a cycle menu in a long-term care facility? A. To offer a completely new set of menu items daily. B. To reduce the overall cost of food purchasing. C. To provide variety while simplifying menu planning and purchasing. D. To exclusively serve therapeutic diets. Answer, C. To provide variety while simplifying menu planning and purchasing. This question focuses on the advantages of using a cycle menu, which is common in institutional food service. The keyword primary purpose directs you to its main benefit. Cycle menus offer a rotating sequence of meals over a specific period, e.g., 3 weeks or 4 weeks, before repeating. This structured rotation provides residents with a variety of meals while streamlining the planning process for the CDM and simplifying purchasing and inventory management due to predictable ingredient needs. For example, a 3-week cycle menu means the same dishes will appear again every 3 weeks. Cycle menus are a balance between novelty and operational efficiency. Question 19. During a performance appraisal, a staff member expresses dissatisfaction with their current responsibilities and desires more challenging tasks. How should the CDM best respond to this feedback? A. Dismiss their concerns as unrealistic. B. Immediately assign them a management position. C. Explore opportunities for cross-training or new responsibilities. D. Tell them to be grateful for their current job. Answer, C. Explore opportunities for cross-training or new responsibilities. This question assesses effective management and staff development strategies during a performance appraisal. The phrase best respond indicates the most constructive and supportive approach. When an employee expresses a desire for more challenge, exploring opportunities for cross-training, special projects, or expanded responsibilities demonstrates that the CDM values their growth and engagement. For example, if a cook expresses interest in menu planning, the CDM might involve them in a small menu review project. This approach fosters employee satisfaction and contributes to a more skilled and motivated team. Question 20. What is the most effective pest control strategy in a food service kitchen? A. Relying solely on pesticides. B. Maintaining strict sanitation and good repair of the facility. C. Leaving doors and windows open for ventilation. D. Storing food on the floor to prevent spills. Answer: B. Maintaining strict sanitation and good repair of the facility. This question focuses on comprehensive pest management in a food service environment. The phrase, most effective pest control strategy, highlights that a multifaceted approach, centered on prevention, is superior to simply reacting to infestations. Strict sanitation eliminates food sources and breeding grounds, while maintaining the facility in good repair, e.g., sealing cracks, repairing screens, prevents pests from entering. For instance, promptly cleaning up spills and crumbs, and sealing any holes in walls, discourages pests. Remember, prevention through cleanliness and maintenance is the best defense against pests in the kitchen. Question 21. A resident has been observed consistently pushing food away, expressing disinterest in meals, and losing weight. What type of diet would the CDM likely recommend in consultation with the RDN? A. Calorie-restricted diet. B. Low-sodium diet. C. Liberalized diet with nutrient-dense foods. D. Bland diet. Answer: C. Liberalized diet with nutrient-dense foods. This question addresses a common challenge in long-term care, encouraging adequate intake in residents with poor appetite and weight loss. The keywords pushing food away, disinterest, and losing weight strongly suggest inadequate caloric and nutrient intake. In such cases, the focus shifts from restrictions to promoting consumption, often by liberalizing, relaxing, diet restrictions if appropriate, and offering nutrient-dense foods, high in calories and protein, that are appealing and easy to eat. For example, instead of a low-fat dessert, offering ice cream or pudding might provide needed calories. The goal is to maximize intake to reverse weight loss and improve nutritional status. Question 22. Which regulatory agency is primarily responsible for establishing and enforcing food safety standards in restaurants and food service operations at the state and local levels? A. Occupational Safety and Health Administration, OSHA. B. Centers for Medicare and Medicaid Services, CMS. C. Food and Drug Administration, FDA. D. Local or state health department. Answer: D. Local or state health department. This question tests your knowledge of the regulatory landscape governing food service operations. The keywords state and local levels are crucial in identifying the correct agency. While the FDA provides national guidelines, like the Food Code, it is typically the local or state health department that adopts these codes and is primarily responsible for inspecting and enforcing food safety regulations within its specific jurisdiction. For example, your county health department conducts routine inspections of all local food service establishments to ensure compliance. Understanding that enforcement often happens at the local level is key. Question 23. A conflict arises between two kitchen staff members over scheduling. What is the CDM's most effective approach to mediate this conflict? A. Ignore the conflict and hope it resolves itself. B. Take sides with one employee to quickly end the dispute. C. Bring both employees together to discuss the issue calmly and find a mutual solution. D. Punish both employees for creating conflict. Answer: C. Bring both employees together to discuss the issue calmly and find a mutual solution. This question assesses conflict resolution skills, which are essential for effective management. The phrase, most effective approach, points to a collaborative and fair strategy. Mediating a conflict involves bringing both parties together in a neutral setting, encouraging them to calmly articulate their perspectives, and guiding them toward a mutually acceptable solution. For example, The CDM might facilitate a discussion where the employees explain their scheduling preferences and then help them brainstorm a compromise. This approach promotes understanding, preserves working relationships, and empowers employees to resolve their differences constructively. Question 24. What is the primary reason for maintaining a detailed cleaning schedule in a food service kitchen? A. To avoid needing professional pest control. B. To ensure accountability and maintain sanitation standards. C. To reduce the amount of time spent cleaning. D. To comply with uniform aesthetic requirements. Answer: B. To ensure accountability and maintain sanitation standards. This question focuses on operational best practices within a food service department, specifically the purpose of a cleaning schedule. The keyword primary reason directs you to its main benefit. A detailed cleaning schedule clearly outlines what needs to be cleaned, by whom, and how often. This systematic approach ensures that all areas are regularly cleaned to maintain high sanitation standards and that staff are accountable for their cleaning responsibilities. For example, a schedule might specify daily sanitizing of cutting boards and weekly deep cleaning of oven interiors. Such a schedule is critical for food safety and operational efficiency. Question 25. For a resident with newly diagnosed type 2 diabetes, which dietary recommendation is most crucial for the CDM to emphasize in conjunction with the RDN's plan? A. Eliminating all carbohydrates. B. Consuming large, infrequent meals. C. Consistent carbohydrate intake at regular intervals. D. High intake of saturated fats. Answer: C. Consistent carbohydrate intake at regular intervals. This question tests your knowledge of dietary management for type 2 diabetes. The keyword most crucial points to a fundamental principle for managing blood glucose levels in diabetic patients. Consistent carbohydrate intake, meaning similar amounts of carbohydrates consumed at regular meal and snack times, helps to stabilize blood sugar and optimize the effectiveness of medications. For example, advising a resident to eat 3 balanced meals and perhaps 1 or 2 snacks at consistent times each day is a cornerstone of diabetes management. This predictability helps prevent significant spikes or drops in blood glucose.